We work with our communities to increase their health literacy and empower them to manage their own health status. But that has to be done differently in every town. So we have 9 small communities, they're all very different.
So traditionally, data sets that health services use are based on large regions. So they look regionally or by local government area. But these ones put local towns first. So we looked wherever we could find it for town level data. This meant that we could find the little differences between each town to get an idea of those issues to create local solutions for the towns.
So we get a much more personal view of what's going on.
The profiles are great in identifying where the real problems are with certain types of illnesses. It really impacts the health care that is sought by the individuals of these towns. It's up to us to address how we can provide a better service for them.
I was really excited to see that West Wimmera Health had actually done some town profiles. We usually get, this is what happens in Victoria, right? This is what happens in Ballarat, this is what happens in Geelong, but we never ever get what happens in Japarat.
We had a collaborative team effort between us and 2 members from the La Trobe University, from the John Richards Centre for Rural Ageing. So we met with them quite regularly to pull together, decide what data we want to include in the profiles, how we want to present them, and what key messages were important to bring across into them as well.
There were a whole bunch of different profiles and how they actually related to Victoria. Actually, I think in every aspect except one, we are much worse than Victoria in general. Our mental health, our lung diseases, chronic diseases.
And so Cafe Health is where we go out to all 9 towns, we go out to the communities and we discuss health and wellbeing with community leaders or just community members who attend, and we essentially take those responses from the community about their own health and wellbeing and put that into action to try and improve that health and wellbeing of that town.
It's actually the combination of the large-scale data sets in these profiles with our annual survey, our 5 Top Things survey.
Which is where us as a health promotion team go in and interview people in each of our towns to get the community's voice of what they think the health and wellbeing in their town's like.
So when we tie those 2 things together, that really does give us fine-grained planning and evaluation material, but it really does that engagement and empowerment for communities over the course of time.
There's been quite a bit of interest in the majority of towns. I'd probably say in Japarat we've had a couple of community members who have seen the profiles and wanted to take action. The mental health conditions have seen that and go, well, it really needs to be improved. It's twice as high as the state average.
We've got a really good health system here and we've got access to a lot of things here, but it's really allowed me, because I've been looking for what the community needs. Dorothy and I are working together to bring a mental health first aid course, just a shortened course to the community.
So the key thing with these profiles is that they engage our communities. They're also a planning and evaluation tool, so they help us to see what we need to do next in that town as opposed to across all 9 towns. So that will tell us over longer term whether or not we're actually having an impact on health status.
Like the feedback we get from the profiles, we can take action and potentially improve the health and wellbeing in that community.
You don't see a lot of people. They don't even walk out the door. So how can we engage those people? But with that data, you can actually kind of say, let's start somewhere.
I think they're a fantastic way of engaging people in health information in a way that's clear, that's understandable, and it's engaging.
It's harnessing the local and the individual that's key for us.
They're very in-depth and they give you a really good snapshot of what's actually going on around us and gives us a chance to make decisions and seek funding, etc. in the right areas.
These profiles tell policymakers what's really happening here in rural communities.
Informative.
Empowering.
Clear.
Valuable.